Now you've been through the mapping, or you expect to go through the mapping in the near future. What you're going to expect now is what happens from week one all the way going forward. So what we're going to do is talk to you about each one of those different expectations. So that way you're ready and you're not getting any surprises. And most importantly, you're also not getting frustrated. So let's put a little graphical representation up. You already know the aspect of the chair and what that chair looks like and how to be able to kind of just be comfortable in the place. You know also about the coil and where it's going to be placed on your head, and also that it's going to have a magnetic pulse that's going to be in place. So those things are kind of pretty self-explanatory. But let's talk a little bit about what to experience in the various different upcoming weeks. So when we look at week one of the things that you really got to think about is having a new routine. So just getting here is going to be at times a little bit challenging, but we work with you in terms of being able to make the time be a good fit for you. In addition, you're going to meet the staff and probably a few different types of people that are treaters. So those are going to be the people you're going to interact when you're in the room, and really is getting you to be able to acclimate to the feeling in the room. Traditionally, if you're comfortable with it, we'll play an app that's called Limitless in our room. And the reason why is because we feel like it activates areas in the part of the brain that we're trying to be able to target that will give you a good response. During the first day 1 to day 5, you might have a mild headache that can be treated with Tylenol. And that traditionally goes away after maybe the first or second day. But I just want you to kind of understand that. One of the things that you can see here is that it talks about relaxing to the routine, being able to really be able to talk to your treater and feel comfortable with them, and being accustomed in the chair and just getting used to it. If there are questions that you have for me and you want to talk to me, it'd be my pleasure to talk to you either in person or on video. So that way you can feel comfortable and know that we're giving you a good experience. So then day 6 through 10 is really being able to kind of figure out, do we need to be able to adjust anything for your own level of comfort, and how to be able to kind of make things better for you, whether it's a darker room or getting the position of the chair optimized as you need to. And then as things kind of go on, one of the things that you'll see in that bottom left-hand component is you might start experiencing some changes. So when we get into day 11 to 25 is when those changes traditionally will start coming. Traditionally around day 16 or so, where you hear your family and your friends talk about you having positive changes. You might have a deeper awareness of some feelings and behaviors, and you may be able to even perceive some improvement in your energy and focus, and that you have improved quality of sleep, you have restored interest in some of the hobbies, and you might even be a little bit more social. Then day 26 to day 30, most of the time you'll have a greater sense of motivation. You'll have some degree of improved resiliency when you have some challenges that are posed to you, and you'll possibly have some questions about, so what happens next? So what are the things that we're going to do from a treatment standpoint? What you need to know is that we're going to take care of you. We're going to make this be a good experience and be able to make sure we're walking with you the whole step of the way. So when we talk about being able to look at those final days, those days of day 1 through 36, one of the things that you should be experiencing is an improvement and relief in your depression symptoms. You should be able to kind of really start being able to take some pride in being able to have completed those 36 sessions and be able to notice that you have improvement that's going to be sustainable. From time to time, we'll look to be able to improve and add on to those sessions if we need to, in order to be able to cooperate with challenges that we might face, but the likelihood is low. You might kind of have this experience of having this weight that's lifted. You may have this greater vibrancy of color. You may have an improved appetite, but not saying that you necessarily eat more. You might just have a better regulation and just feel more focused and more at ease as a whole. So hopefully that helps give you some explanation about what to be able to expect and when to be able to expect it. And at any time during this journey, if you need to talk to the treaters about it or talk to myself, don't feel uncomfortable with having that discussion. Hopefully this has helped you greatly, and we look forward to being able to treat you in the near future. Take care.